Good morning, everyone. We are Doctors Mike and Mary Shapiro. You are here for Mental Health in a Messy World, right? Okay, good. The fact that you're in here must mean you all have mental problems yourselves, so that's okay. We won't. That's what I like. Openness about your problems. That's very refreshing. No, I'm kidding. You can tell everyone you're in this class because you want to help friends of yours with issues. You can do that. That's what I do all the time. So thank you for letting us be here. We are honored to easily be the oldest people in about 5 square miles. So, we better do this quick because our time is limited on this earth. So, but we appreciate you. I'm just kidding. So, by way of background, hi, Gregory. By way of background, we are both clinical psychologists. We've been doing this kind of work for 45 years. 45 years! And we haven't cracked up yet, so I think we're doing okay. But we've always worked together. And we've worked with people of all different ages, from little kids, preschoolers, all the way to geriatric patients. So we have a lot of experience, and I want to start out with an interesting observation about the last 45 years. The people we're seeing, the patients we're seeing, are getting more severe, more complicated. Every time I think I've heard the most terrible story, mental health story there is, then it's the next day, and I hear something else. We actually work right now in Fayetteville, North Carolina, which, if you know anything about it, is the Fayetteville. If you know anything about it, it's the home of the biggest Army base. I think it's the biggest military base on the planet. And there are a lot of veterans with PTSD, really severe, terrible stories I hear. So the good news for us is we'll never be lacking for customers. So thank you for giving us a way to make a living. We really appreciate that. But only if you have good insurance. If you think about why have these problems gotten more severe in the time we've been doing this, 45 years? Who are you going to blame in the last 2 decades for all human ills? Social media. And our phones, and because if you think about it, if you don't have a mental health issue, or you think you do, all you have to do is get on social media and someone will convince you that you have a mental health issue. Or if you really have one, someone on social media will tell you the exact wrong way to take care of it. I mean, we see a lot of teenagers, and they're telling us about, YouTube things on how to commit suicide and so forth. So it's making our heads explode. And, fortunately, Mary's going to retire soon, but I'm going to keep at it. So things are getting worse because it's a messy world. It really is a messy world. And we're dealing with things we never thought of that we would see when we started out. Now, you may look at this slide and say, but we're college students. We don't have mental health issues because we're young and we're naive and we're happy. And life is our oyster and it's all one big storybook adventure. We don't have any mental health issues. Well, let me show you some sobering statistics. No talk is worth anything without statistics. According to the NEA, that's the National Education Association, which sampled 90,000 students, 133 campuses, this is what they found out. More than 60% of college students meet the criteria for at least one mental health problem, and that's one at a time. You may have multiple comorbidities, meaning lots of mental health issues. 50% increase since 2013. That's pretty sobering right there. 44% of students report symptoms of depression. You may be thinking, wow, I'm surprised it's that low. Everyone I know has depression. 37% experience anxiety. I would say 30% of you in here right now probably are experiencing anxiety. I don't know. 15% reported considering suicide. Now, that's not just passive suicidal thoughts. We all have passive suicidal thoughts. Oh my goodness, my life is just going to be like this. I don't know if I want to go on. That's a passive suicidal thought. This is talking about actively making a plan. So these are some pretty significant statistics, pretty frightening. Now, if you think about it, men and women present differently with certain mental health problems, so I thought I'd take a look at this slide. According to Abnormal Psychology, it's an article from 2011, women are more likely to be diagnosed with anxiety or depression, while men tend towards substance abuse or antisocial disorders. Start thinking about why that might be. Women with anxiety disorders are more likely to internalize their feelings, which typically results in withdrawal, loneliness, and depression. Men, on the other hand, are more likely to externalize emotions, which lead to aggression, impulse problems, coercive, and non-compliant behavior. Women suffer more than men from depression because women ruminate more frequently than men, meaning they get these thoughts in their heads and they can't stop thinking about them over and over. Focusing repetitively on their negative emotions and problems rather than engaging in more active problem solving. Well, what do men do when they have depression or anxiety or mental health issues? So women talk, they open up, they talk to each other. What do men do? They suck it in. They suck it in, they stuff it. We're told, we're acculturated as men, at least in the United States, to put on our big boy jammies and, suck it up, put our heads down and barrel through and stuff it. Stuff the feelings, stuff it. That's not good because it ends up coming out in impulsive, aggressive, coercive, and non-compliant behavior. So, just told you all that to let you know the way these mental health disorders present are different from men versus women. So if you see a dude that says, I don't have any mental health disorder, you probably have a mental health disorder. Now, what about this issue? We get asked about this a lot. Doesn't the fact that we are disciples of Jesus and have the Holy Spirit and a close spiritual family, aren't we therefore immune from mental health problems? No. Discipleship does not confer immunity from mental health issues. In fact, for reasons I'll talk about in the next slide, there were early days in our church movement, before y'all were born, where people would get baptized, and whoever baptized them would raise them up out of the baptistry and said, so-and-so is now your brother in Christ, and he's going to throw out all his antidepressant medications because he doesn't need them anymore now that he's a son of God. And we're like, no, you don't want to do that. Fortunately, it's not so much like that anymore. But if you look up later these references in Genesis, mental health issues are just like physical health issues. Being a disciple doesn't make you immune from pneumonia or, cancer. Last year I was treated for cancer. And I knew discipleship wouldn't protect me from it, but it would help me deal with it. It's just one of those many things, the Pandora's box of terrible things that was opened when man fell from grace. It's no different. Mental health issues are no different in that respect from cancer, pneumonia, kidney disease, high blood pressure. So that's just a consequence of a fallen world, living in a fallen world. What I want you to know, and I talk about this at every mental health every mental health workshop that we do, there are 4, and if you get nothing else out of the next hour, this is probably the most important thing to remember. Every mental health issue that we're going to talk about has 4 components to it: the biological, the psychological, the social, and the spiritual. Back in the early days of our movement, we thought that depression, anxiety, all mental health issues were just spiritual problems, right? And we used to think if you're depressed, it's because you're not praying enough, you're not reading your Bible enough, you're not getting discipled enough. And we didn't pay much attention to these other things, the biological, the social, and the psychological. In the world of medicine, my job now is to train young physicians. I work in a family medicine residency program. I train young physicians who are becoming family docs. They tend to think everything is a biological issue. If you're depressed, it's because, you're taking this medication that can make you depressed, or you have thyroid problems, which could make you depressed. Or, I can give you some medicine to treat it, and they don't pay much attention to the spiritual. I tell them all the time, I don't care if your patients say they're atheists and don't believe in God. When a patient is experiencing chronic pain or is on their deathbed and close to death, they're praying to something, even if they've been atheists their whole lives. So every mental health issue has a biological component. Problems with brain chemistry, or problems with hormones, or you're taking a medication that's causing depression. Those are examples of the biological. The psychological dimension is things about your own personality and your own temperament. Some people tend to be kind of negative in their outlook. Some people tend to be overly positive in their outlook. The way you were raised, some people have been victims of abuse or trauma. Those are all in the psychological component. The social dimension is where you were raised and how you were raised. Were you abused as a child? Did you have any childhood adverse events like abuse or trauma? Were you raised by a family that was loud and emotional? Were you raised by a fragmented family where you were shared between two households or more? Those are all the social dimension. And of course, the spiritual dimension is the one you know about. And what we tell everyone is, if you ignore that part, the best we can do for you as psychologists is get you to tolerate life. Like if you don't have a relationship with God, we can give you medication, we can put you in therapy to handle the psychological and social impacts. But if you don't have a relationship with God, all you can expect out of life is to tolerate it. You'll never be truly happy, you'll never be truly fulfilled. And I feel like telling that to all my patients, even my non-Christian patients, but I can't. Ethically, I'm bound to not say that, but that's, short of having a relationship with God, what we're doing is patching and mending and putting you back out on the street. So does that make sense? 4 components to every one of these psychological things we're going to talk about. It's not just spiritual, as we used to believe, and it's not just biological, as the world would make you think. Let me let Mary, I'm going to stand right next to her because I'm going to flick I forgot my clicker, so my finger is going to be my clicker.
Yeah, before we go on and start talking about some of the mental health disorders, we got to talk about some normal stuff first. College is a weird time, right? I mean, it's been a little bit since I've been in college, but I still remember it a little bit since I've been in college. But I was in college for a long time, so I remember it, okay? Tell me some of the stressors you have in college, normal stresses in college.
Exam week.
Exams, all right? Academic stress.
Time management.
Time management.
Falling back on students.
All right. All right. We're doing all academics, and that is very stressful. Tell me some other things. Managing relationships. All right. You're making friendships. You're dating. You're becoming an adult in the family you were raised in. Yeah. Finances.
There you go.
All right. Who is independently wealthy in this room? Raise your hand. I want to talk to you after class. Yeah. What else? What are some other stressors? Anyone, just call it out.
Sleep management.
Sleep. Wake.
Sleep. All right. Yeah. Take care of yourself.
Spending time with family.
Spending time with family. All right. How about choosing a major? All right. This guy, whatever you're majoring in, he majored in at some point before he got his bachelor's degree. I mean, choosing a major is a big one, right? What am I going to do when I grow up, right? That's a big one. What am I missing?
They named everything.
I think you named everything. Okay, a lot of stressors when you're in college at the phase you guys are in.
In addition to balancing academic and church.
Yes, that's what I was missing. Yes, academic and church life, balancing that, So there's some normal stress and anxiety and even depression that you go through when you're going through these stressful times. That's expected. We have tests where we kind of measure your stress level, and when we see how high it is, we're like, oh, well, no wonder you're not feeling great, because look at all the stress you've got on you right now, So there's some normal things. So we can't see everything as a mental health disorder is what I'm talking about, all right? There's some normal life issues that we all go through. I hate to tell you, but it doesn't go away after you get out of college, all right? Then it's other stressors. The stressors just change. But there's some normal anxiety and angst that we all go through in dealing with life.
And don't diagnose yourself.
What I would encourage you to do is don't Google your symptoms and diagnose yourself, all right? Do not do that. That's not beneficial to you. When we do diagnostic evaluations, which is what I'm doing right now, we spend at least 3 hours giving tests to people. Individual tests that measure individual things. And we usually give a couple of tests that measure the same thing. So we're not just getting one measure. So diagnosing yourself is a lot harder than just Googling your symptoms online. So please don't do that. Save yourself some problems. Okay, so when is it not normal? When is a problem really a problem? You know, mental health professionals talk about a problem isn't a problem until it interferes with educational, occupational, social, or family functioning. In other words, if I can't get up and do what I need to do every day as a human being, it might be a problem. All right? If I am so depressed that I haven't gone to class in the last week, it might be a problem that I need some help with. Have the symptoms persisted for more than 3 months? You know, we all have bad weeks. We all have bad weeks, right? You know, but if something has gone on for several months, that might be something you need to get help with. Any time that you or anyone else is dealing with any kind of suicidal thoughts, passive or active, you need to get it checked. That is not something to just overlook. That's kind of a red flag. So any kind of suicidal thinking needs to be addressed.
In particular, if you hear someone who's suicidal and you just think in your head, oh, you know them, they're just looking for attention or they're being manipulative. It doesn't matter. People who harm themselves out of being manipulative or seeking attention end up just as dead as people who do it out of depression. So never trivialize, minimize suicidal thoughts. We're going to give you a quick, I know you've taken Psych 101. I just took it and it was really boring. But we're going to give you a quick psychopathology lesson on a few mood disorders that you're most likely to see. And Mary's going to talk about how each one of these affects you spiritually. So we're going to start out with some mood disorders. You've heard of depression before, but what you might not know is there's lots of different varieties of depression. The one you hear about most is major depression, major depressive disorder, which is an episodic disorder. It's not constant. It's like sometimes you're just going along and life is just fine and there's no issues going on, and this thing hits you like a truck. And all of a sudden you are down and out and you're thinking, why am I so depressed? I'm crying all the time for no reason. I have no energy. That's called anergia. I don't find any joy in anything I'm doing anymore. That's called anhedonia. Those are vegetative signs of depression. And it hits you like a truck and it stays that way for a while, maybe hours, maybe days, maybe months. And then you bounce back to a baseline and you're like, what was that all about? I hope that never happens again. But then it happens again. That's major depressive disorder, and it's during the depressed phase that you might be suicidal, or you might, your grades start going down because you're not going to classes. So that's like I said, that's one you hear about the most. But there are other ones. There's something we used to call dysthymia, but we figured out that as mental health professionals, if we can give a disorder more names, then we can charge more for it. So we don't call it dysthymia anymore. It's called persistent depressive disorder. That's more of a low-level but chronic depression. It's not episodic like major depression. It's kind of this, you can still go to school, you can still do your job, you can still do things, but you just don't have any joy. It's just like functioning under this burden, carrying this burden all the time. I call this the disciple killer, especially with men. Because men, if they feel that way, they're not going to complain about it, especially, or talk to their buddies about it and risk losing face. They're just going to function under this burden. And I've seen plenty of men who don't come to see me until they're well into their 50s. And, I'm like, why didn't you do anything about this before? And we get them treatment and they really feel much better. Then there's bipolar disorder, which you see on movies and TV shows all the time. It's not like they show. You guys throw that term around all the time. Oh, you're so bipolar. You're just saying that to anyone who is moody, right? If they're kind of moody or they're grouchy, oh, you're so bipolar. No, bipolar is not like that. Bipolar, clinically, is a very serious disorder where you go through those episodes of depression I was just describing, but they alternate with periods of mania. During the manic phase of bipolar, you feel great. You feel energetic, and life is awesome, and you don't sleep because you're so energetic, and you move from one thing to the next, and then you start doing crazy things. The most popular crazy things for people in a manic phase to do is to spend money indiscriminately, and they get in terrible debt. Or they have sexual encounters indiscriminately. Anything to, and then they just feel great, and I'm going to build a nuclear reactor in my garage, and then I'm going to knit a garage to go around it, and then, But then you hit this wall. The problem with bipolar is everyone feels so good in the manic phase, that's when they throw out their medication. And they say, I don't need this anymore. But inevitably they hit that wall and you're back into a major depressive episode. So those are the three you're most likely to see. And Mary's going to talk about their spiritual consequences.
Yeah. Some of the spiritual struggles that go along with these disorders, and let me, I always try to, when we're talking about mental health issues, and Michael said this a little bit, but none of these disorders disqualifies you from being an awesome Christian, an awesome, fruitful Christian, And we have known Christians that have had every one of these disorders and been amazing disciples. So none of this disqualifies you or means anything about your relationship with God. But they do come with their own struggles. Some of the spiritual struggles with mood disorders, especially with depression, is negative thinking. When you're depressed, you are very negative about the world and you're very negative about yourself. I have sat in the room with sisters, Christian women, who have led churches for years and done amazing things, been on the mission field, and they're depressed and they're telling me nothing I've done has been worth anything. And I'm like, that's not true. That's the way you feel right now, but that's the depression talking. That's what I tell them. That's the depression talking. That's not true about you. That's the depression talking. But that's a very hard thing to deal with. Hopelessness, feelings of hopelessness. I'm miserable, and I don't think I'm ever going to feel any better. That's what leads people to suicidal thoughts, is that feeling of hopelessness. Again, that's a symptom of the depression, but it feels very real when you're in it. It feels very real. Like Michael was talking about with the cyclical disorders, like bipolar disorder, one of the problems is this impulsive behavior. A thought, I get this thought that I'm going to go, put $2,500 on my credit card, and I just do it. I'm very impulsive in what I do. That can be a real problem for a Christian. And just inconsistency. It is hard to study your Bible when you're depressed, if you have never been there, all right? You get up, you open your Bible, you say, I'm going to do it today. You read for 15 minutes, and at the end of the time you go, I don't remember one thing I've read. Not one thing I've read. I don't remember one thing. Because these things wear your brains out. So again, this is part of the illness. This is just part of the illness. If you had the flu, you wouldn't expect that to be your best spiritual day ever, right? Right? Okay, yeah, and so we need to acknowledge that as Christians, if we're dealing with some of these things, it makes staying close to God hard in some ways.
Let me say one additional thing about impulsive behavior, because we get asked this a lot, and this is a very controversial question. How much is sin and how much is the bipolar talking, or how much is the depression? That is an excellent question. We deeply believe, after doing this for 45 years and after being disciples for about that long, that nothing, with the possible exception of schizophrenia, which is a severe disorder where you have delusional thoughts, with that exception, none of these disorders we're talking about make you sin, can compel you to sin. Even if you have bipolar disorder and you're in a manic phase, you know the difference between right and wrong. You know the difference. It's just going to be much harder for you to obey your conscience and to obey God and the suggestions of other people because of this impulsiveness. Same thing with even relatively simple things like ADHD. Yes, you're more impulsive, but if you have deep convictions about what's right and wrong and you draw on all your spiritual resources, it'll be harder, but it's not. Nothing will compel you to sin. So I hope that's clear. Let's talk about some of the anxiety disorders, which is a popular, lots of people with anxiety. So the one you hear about the most in the anxiety disorder world is generalized anxiety. That's when you worry about everything all the time. And the difference is, like, a lot of people are worrisome, right? A lot of people just tend to be worried people. My mother, Jewish mother, had anxiety like an art form. She had it honed into an Olympic sport. Her nervousness and worry, I mean, she was, if Rembrandt was worrier. She would be the Rembrandt of worry. I mean, she had it. The difference is, though, it was not a disorder for her because she didn't think it was weird that she had these worries. In fact, she thought the rest of the world was weird for not worrying about these things. People with generalized anxiety have these worrisome, intrusive thoughts, but they realize they're irrational, but they can't stop them. Let me skip down one. OCD is when you have obsessive-compulsive disorder. Now, that's another one y'all misuse all the time. When you walk into someone's dorm room and it's really neat, you go, oh, you're so OCD. Stop doing that. That's not what OCD is. Obsessive-compulsive disorder is when you have an anxious thought that you can't get out of your head, so you try to neutralize it with a compulsive behavior, like everything has germs. I can't stop thinking, getting contaminated and sick. So I'm going to go wash my hands. Oh, yeah, even before the pandemic, because the pandemic made this all normal. So I'm going to go wash my hands. And then you're leaving the bathroom and you're like, oh, no, I touched the doorknob. Now I've got more germs and I have to go wash my hands again. So OCD is fortunately, it's very treatable, but it's untreated. It's a very crippling illness. It really, but it's an anxiety disorder, kind of anxiety disorder. So generalized anxiety disorder, OCD. Panic disorder is when you have that fight or flight response for no reason that's triggered. You know, fight or flight response, usually we're confronted with a threat. You learned about this in Psych 101. And it triggers this whole hormonal and neurological reaction that prepares you to either fight the threat or run away from it. So panic disorder is when that happens when you're not confronted with anything threatening. What happens when you're in the midst of a panic disorder, you have those same reactions. Your respiration increases and your heart rate goes up and you have these feelings of impending doom. Panic disorder is the biggest statistically reason for admission to emergency room departments for non-medical issues. I think it's something like 89%. Did you know that 90% of statistics that speakers say are made up by the speaker right on the spot, which is what I just did. So it's a high percentage of people with panic disorder go into emergency rooms for something that is not truly medical. And then PTSD, which, like I said in Fayetteville, I've been seeing so much of, it just makes my head explode. Here's what you might not, so when you hear PTSD, usually associated with military service, right? These veterans who've seen and heard and done horrible things, and it haunts them for the rest of their lives. The symptoms of PTSD are things like you have to have nightmares, they call it re-experiencing the trauma. You have to have hypervigilance, which is where you're always on edge thinking this is going to happen again. You know, these poor veterans, they hear a car backfire in the street and they're like, hit the dirt, incoming. You know, I mean, it's that bad. Here's what you probably don't know about PTSD is you don't have to have been the victim of the trauma to experience PTSD. All you had to do was hear about it or see it. You know, after 9/11, we had this upsurge of people with PTSD that weren't in New York when it happened. But what were they doing? They're watching the news clips over and over and over again. PTSD is big in our profession because of what we call shared trauma. When you hear enough traumatic experiences from your patients, you're going to develop some of that same concern. We'll take Q&A in just a minute. Mary's and my solution to preventing PTSD from being exposed to so many traumatic patients is we've hardened our hearts to people and no longer care about them. So it's really an ironclad solution. We just see people now as numbers and paychecks. So it's, you know, I'm kidding, totally kidding. Maybe they can erase that part on the tape.
If you guys haven't heard Michael speak before, let me help you out. You assume it's a joke until you find out it isn't one, all right? That'll kind of help you. That way we're all on the same sheet of music. Okay, let's talk about some of the spiritual struggles if you're dealing with an anxiety disorder. Like Michael said, if you have an anxiety disorder, it makes you feel very different from other people because you know, this is not logical that I worry about germs all the time. This is not logical, but it doesn't make make the anxiety go away just knowing that. And so it can keep you isolated from other people because you feel so different. And it can keep you from sharing with other people some of the challenges you have, which is very important for you to have that support system. One of the worst things about anxiety disorders is when a person is dealing with an anxiety disorder. Every time I go into a store, I'm afraid I'll have a panic attack. And so what most people do is they stop going to stores. And that actually makes the anxiety disorder worse. Part of the treatments, most of the treatments for anxiety disorders are some kind of exposure treatment, where you slowly expose the person to the thing that's making them anxious. But the natural reaction is, if I get anxious every time I drive, I'm just going to stop driving, right? But that actually makes it worse. So those are some of the struggles. Spiritually, it can be things like, I get anxious every time I'm in a crowd, so I don't go to church anymore. All right? Yeah. That can be a real problem for people that are trying to be Christians, So those are some of the things that we're dealing with.
So when that happens, we recommend doing things like, okay, don't force the disciple with an anxiety disorder to go to church. What you're going to do is find one person that they're close to, and we're going to start small. We're going to watch it online from the comfort of my home with your best buddy, disciple buddy, and then maybe we'll go to, once you get used to that and you feel comfortable and you're in treatment, you're on your medication, you're in therapy, then we're going to go to, maybe a midweek or, one service every month. So there are ways to deal with all these things we're talking about. Now, for college students, there is some good news, is that if you have, hang on. That wasn't supposed to happen. If you're a college student and you have any of these issues, most universities have CAPS, Counseling and Psychiatric Services Centers. Public universities always do. Most private universities have them too. The good news is they're very experienced at dealing with college student issues. The best news is it's free. It's usually part of your tuition. You don't have to pay more for it. Some of them limit it, like you can only go 5 times, and then if you're still having the trouble, they'll refer you to somebody in the community. I don't know. But it's an easy way to get help quickly if you're a college student. Now, if you're thinking ahead and you're like, wait a minute, what if I get one of them their therapists that doesn't believe in the Bible and starts recommending non-biblical ways of treating this? Then what do I do? Well, I'm going to refer you to this. I'm going to show you a video, which is conducted by a man much older and wiser than I am. So this is, much better. So just listen to this guy. The guy's brilliant.
And the power of AI to build the website
After we get past this.
with full business functionality and design tailored
Okay, ignore that part.
just for you. Customize every element of your website and watch your vision.
What?
That's a skip button.
I'm pressing it. I'm clicking the skip button. I know what a skip button is. What? Why? In my day, we used rocks and sticks to do presentations. I'm hitting the skip button. It's not doing anything.
Control everything from the biggest tasks to the finest details.
Anyone who wants to...
Ready
Yeah.
to go live.
All right, here we go. Here we go.
You got it?
Thank you. That was a test of your
I'm Mike
IT.
Shapiro. For over 3 decades, I've been a practicing clinical neuropsychologist. I'm also a Christian. So let's say you're a Christian, and it's been recommended that you receive therapy or counseling. So if you can't find a therapist who's a Christian, what do? Do you stop the search, or do you keep looking? Well, that's a good question, and here's some things I want you to consider. So in your search to find a counselor or a therapist, I understand that you would like to see a Christian. I know Christians who are mental health professionals at all these different levels. But let's face it, there just aren't enough of them to go around. The first thing you should know is that there are a lot of different kinds of mental health professionals. Let's talk about the doctors. I'm talking about psychiatrists and psychologists. I'm often asked, what's the difference between a psychiatrist and a psychologist? Well, about $30 an hour. Psychiatrists are medical doctors. They're trained to use medication and to understand how medications interact with the body. Psychologists specialize in psychological testing and therapy. Then there's a plethora of people with master's degrees that go by different names. There's licensed professional counselors, licensed clinical social workers, and marriage and family therapists. You usually recognize them by their designations like LPC, LMFT, LCSW, NFL, FBI, CIA, WWE. Okay, not those last ones. So don't be scared to ask. What are your credentials? What is your experience with treating my condition? How long have you been doing this? What are your degrees? Don't be shy. Be a wise consumer. So, if you're in the United States, every mental health professional, no matter what kind, has an ethical obligation to honor your personal worldview. So regardless of what kind of counselor or therapist you see, I would suggest that the first thing you should do is to make it clear that you're a Bible-believing Christian and that you won't do anything that goes contrary to the Bible or to your personal convictions. Counselors who are unwilling to accept that are not doing their job, and it would be my advice that you go elsewhere. The next thing you should keep in mind is that there really needs to be some kind of connection between you and your therapist. You should feel listened to, cared for, understood. If you don't feel that kind of connection with your therapist, it doesn't matter if he or she's a Christian, you won't get very far in therapy. Also, when you're searching for a therapist, whether or not the therapist is a Christian, you need to be able to work with your therapist to come up with a plan. You need to know the answers to questions like, how long do you think I'll be in therapy? How frequently will I see you? What are our goals? What is your approach to therapy? If your therapist can't give you a definite plan, it doesn't matter if he or she is Christian or not. You probably need to see a different therapist. So, although it might be helpful for your therapist to be a Christian, there's some other things you should consider that might be even more important. If you can find a counselor or a therapist who makes you feel listened to, who's respectful of your worldview, who has the experience and credentials to help you with your particular issue, and will work with you to come up with a plan, then I think you found a pretty good counselor. So if you've been searching for a while for a Christian counselor and haven't been able to find one, but you have found a counselor or therapist that meets these qualifications, I would advise you to stop your search and start getting the help you need. My wife and I have spoken extensively about this.
I don't know about you, but I found that deeply inspiring. I mean, that was both moving and informative. In fact, I think we'll use the same guy for the next question, which is always about medication, Christians taking medication. So you know, if not yourself or someone really close to you, you know somebody who's on some kind of antidepressant, anti-anxiety medication or something like that, ADHD medication. They're part of that biopsychosocial spiritual toolbox, okay? Medications help with the biological... Well, what am I saying? I'm going to let this guy explain it. Hopefully there won't be a skip. If so, it'll just be short. Oh, good.
My name's Dr. Mike Shapiro. My wife and I have been clinical psychologists for over 36 years, and we've gone all over the world talking to different churches about mental health issues in the context of biblical Christianity. One thing we get asked about a lot is whether or not Christians should take psychoactive medications for things like depression, anxiety, bipolar disorder, and schizophrenia. Isn't it caused by not reading your Bible enough, or not praying enough, or not going to church enough? I've spent a lot of time thinking about this question, and it's a very important question. Here's a few things I want you to consider. conditions like depression and anxiety have a biological component, just like cancer and heart disease. For example, scientists have learned that one of the causes of depression is a deficiency of certain neurotransmitters in the brain. Neurotransmitters are the chemicals that allow brain cells to talk to each other. If people don't feel uncomfortable using medication to treat things like cancer and heart disease, why would they feel uncomfortable using medication to treat anxiety and depression? Now, I understand that things like depression and anxiety have a psychological and a spiritual component, but until we take care of the biological component with medication, we're not going to make a lot of progress with the other two. In the book of 2 Kings, in chapter 20, it talks about King Hezekiah. He was one of the most righteous kings ever to rule over Judah. Late in his life, Hezekiah got seriously ill and was about to die. He prayed to God, who sent him an answer through the prophet Isaiah. In verses 5 and 6, Isaiah tells Hezekiah that God has heard his prayer and will add 15 years to his life. But this is what it says in verse 7. Then Isaiah said, "Prepare a poultice of figs." They did so and applied it to the boil, and he recovered. Incidentally, we know that poultices made out of figs can be used as an astringent, which draws infection away from the body. Now, certainly, God could have healed him instantly and miraculously. Why he didn't do it that way, I don't know. But in this instance, God wanted Hezekiah to combine his faith with a medical treatment. 15 more years. Man, you know, if God told me I was going to live for 15 more years, I'd probably eat a Big Mac every day for the rest of my life. Probably still get sick, but at least I wouldn't die, right? There's another story in 2 Chronicles 16 about another righteous king named Asa. He did what was right in the eyes of the Lord, but when he was stricken with a foot disease, all he did was take the medicine, and he didn't consult God at all. This resulted in his demise in about 2 years. If he had only sought help from God, maybe God would have blessed the efforts of his physicians. Over many years, I've worked with Christians who have expressed a deep desire to grow spiritually, to read their Bibles more, to pray more, to serve more. But they suffered from things like depression, anxiety disorders, or bipolar disorder. These Christians were often hesitant to take medication because they saw their symptoms as some kind of moral weakness or some kind of character flaw. But usually what happens is, when people take these medications, it relieves their symptoms enough to allow them to apply themselves to spiritual growth. In my opinion, that's the role of psychiatric medication in the lives of Christians. It's a tool, just like therapy is a tool. Once the cloud of anxiety or depression has been lifted, the person can think more clearly and apply God's word more effectively. My wife and I have spoken about this and many other topics for many years.
Plenty of shameless plugs there. So I hope that was clear. That condensed a very controversial subject into about 4 minutes, and we can do some Q&A in a little bit. But let's finish up with what can we do to prevent all this from happening in the first place? What are some proactive lifestyle changes you can make to help mitigate the likelihood that you might develop a depression or an anxiety disorder? Most of those disorders, the onset of these disorders is usually late teens or early 20s. So you're at kind of this high-risk age of life. They're more common in families. So if you have family members with anxiety, depression, bipolar disorder, schizophrenia, any number of things, you're more predisposed to it. But does that mean you're necessarily going to develop this disorder? It's less likely if there's a few things you can do proactively. So I'm going to let Mary talk about the first couple.
All right, let's talk about some preventative medicine. And some of this is going to sound really simple to you guys, but I really want you to think about it for yourselves. The first thing I want to ask you about is, how's your diet? How is your diet? Now, I get it. You're in college and you're busy, and Pop-Tarts and ramen noodles are cheap. They were cheap when I was in college, all right? I get it. But we all know what we need to be doing in our diet. And I'm not talking about looking great at the beach this summer. I mean, that might be a side effect, but I'm talking about keeping your brain healthy. There is now a whole field of science called nutritional psychiatry. And that's all they're looking at is, how does our diet affect our brain? We know that it has a huge effect. If you're drinking 5 caffeinated drinks a day, you're going to be feeling anxious. You're going to have some anxiety, all right? So we logically, we know this, but we don't spend a lot of time thinking about it, especially when we're young and healthy, all right? You may not think about it. So we know what we're supposed to be doing. Less processed food, more whole foods, fruits and vegetables, healthy proteins, right? I mean, you can pick up any book, any magazine, turn on any TV show. We know what our diets are supposed to look like. And I've been doing a lot of workshops in this nutritional psychiatry area, and sometimes it's overwhelming. I mean, you do, a full day workshop on this, and you're like, oh my gosh, I can't possibly. So what I would encourage you to do is change the one thing you know you need to change to make yourselves healthier. Change one thing that you know you need to change. In our family, we had to have a French fry intervention with Michael one time. We were like, we know you love French fries, but you can't eat them at every meal, all right? That's just not a good thing for you, all right? So change the one thing you need to change. It's what I would encourage with your diet.
It was a dark time, okay?
And all of this, again, in the area of nutrition, all of the studies say the earlier you start, the healthier it is for you. The earlier you can start at any time, but the earlier you start, the better you do long term. So think about your diets. Exercise. When I see somebody in therapy for depression or anxiety, the first homework assignment they leave with is you've got to figure out how to exercise 3 to 4 times a week. And the reason for that is because it is first-line treatment for anxiety and depression. First-line treatment. There is one study that's up here, just one study, and this is one study out of hundreds of studies about the benefits of exercise, that says if you burn 350 calories 3 times a week in some type of sweat-producing exercise, it can be as effective in treating mild to moderate depression or anxiety as prescription antidepressants. That's huge. All right? That's huge. So you can, and again, I know you guys are busy, but the exercise has got to go on I have to figure out how to do this, as opposed to I'll do it when I have a chance. I'll do it when I get a chance. We're so convinced of this research that we keep seeing over and over and over again. Pretty much 5 days out of 7, we do some form of exercise. He gets up at 5:30 in the morning, drives 70 minutes to work, gets home about 6:15, 6:30 in the evening. Most days he still does 30 minutes of exercise. I mean, that's how convincing this research is when you look at it.
Besides, do you think this comes easy? Come on. That only costs me 350 calories a day of exercise. Here's something we don't talk about much in terms of preventative medicine. We talk about it in the abstract as brothers and sisters in Christ, but friendship. The study I like to cite is, you know who the Gallup organization is? You've heard of them? They're a polling organization. They kind of do surveys to figure out what the big issues are in the United States. And they did one on homelessness. What is the root cause of homelessness? Now, you would think it's, educational attainment or, job opportunities or geography or the size of your family or whatever. They did this poll and they found out that most homeless people, when they said, how did you end up homeless? They said lack of friends, not enough friendships. So they did these other studies and they came up with these interesting statistics. If your best friend eats healthy, you're 5 times more likely to eat healthy yourself. Why is that? I don't know. For guys, it's probably a competitive thing. It's like you go to a restaurant and your buddy orders a quinoa salad and you're like, oh yeah, well I just want pebbles and sticks. It's like a competitive. I don't know. But you'll eat better if you have good friends that eat better. Those who have no real friends at work have only a 1 in 12 chance of feeling engaged on a job, but if you have a best friend at work, you're 7 times more likely to feel engaged. So I encourage the young physicians I train, I tell them, look at each other. It doesn't have to be you guys in your little group. It can be other people that understand what you're going through. As long as you have a best friend, you're going to do better and everything. And you guys have friends. I'm talking about intimate friends that you can be the real you in front of, that know everything about you, your weaknesses, your sinful proclivities, all the fun things about you. Those are the friends you want to cultivate. And lastly, my favorite topic, hobbies. And I'm bringing this up. Now, some of you are like, yeah, I play Call of Duty all the time. That's my hobby. I'm not talking about, no. Hobbies, this is another thing where with my young physicians, when we first hire them on, I say, what do you do for fun outside of medicine? And they say, well, I used to play the piano. I used to knit. I used to bake. I used to do ballroom dancing. I used to whatever. They don't do it anymore because they're busy and they're making themselves. That's one thing that could really help with their mental health and with yours. Now, I'm not talking about passive hobbies like video games. Some hobbies are mindful. Mindfulness is a state where all you're thinking about is what you're doing at that moment. You're not thinking about the past, which is already done, can't do anything about it. You're not thinking about the future, it's not here yet, can't do anything about it. You're totally focused on this activity. So that's hobbies that involve, it's fine to get on the elliptical and the, rowing machine, but I'm talking about things that engage your mind like strategic sports, dancing, ballroom dancing, anything, tennis, anything where you got to think. We did ballroom dancing for a long time, and I had to think, or else I was stepping on her feet all the time. So anything that engages your mind as well as your body. Now, once again, you already know this, and some of you are like, I'm fine with the hobby thing. I got to work on all this other stuff, like exercise. What I'm going to ask you is, if you already know this, why aren't you doing it? Because you're saying, I know what you're saying, hobby, that's just an indulgence. I'll do that when I get a chance. Or I'll hang out with friends when I get a chance. I don't have time to do that now. Or I'll work on my diet when I get a chance. If you think that way, you're going to end up old and decrepit like us. You have to start now making these lifestyle changes and moving them up the priority list from when I get a chance to I'm going to schedule this into my schedule every week. Every Sunday, I'm going to sit down Sunday night, look at my week ahead. From this hour to this hour on this day, I'm going to exercise. From that hour to that hour on that day, I'm going to exercise. And nothing's going to stop me unless Jesus comes back or there's a nuclear holocaust. Nothing's going to prevent me from doing these things at these times. Once you do that, you get in the habit of it, and it all becomes second nature, and you won't even think about it. So those are just 4 of many lifestyle changes you can do proactively to prevent more serious mental health issues and stress and burnout and things like that while you're young. Thank you so much, everyone. I want to get to the end.